Most recent surveys that looked at the prevalence of HIV in Nigeria have shown that Nigeria's prevalence has been declining, particularly among the youngest age group, meaning that new infections on average have been on the decline. Most recent it's 4.1%, and as you know, in years past the prevalence was much more than that, but 4.85 at some points. Now, while that has been very positive news, the progress is uneven. There are areas whereby the progress actually is not progress. In fact, there are pockets where some states have more HIV prevalence than other states. But despite that, given our large population, we're 167 million people. So in terms of absolute number of those affected, we have the second highest burden of HIV infection in the world. And that's significant. While there's been progress in terms of getting people to be treated, those who are HIV infected, but it's still not enough. There's a lot more room to actually treat all those who are eligible to be treated. In terms of response, as you can imagine, there are three main elements to that. One is the preventive side. I think there's been lots of effort in the recent years. NACA, the agency that is responsible for this effort, has been doing well with the states as well as other non-governmental entities and the global development partners to improve prevention, getting people aware and also taking measures to prevent themselves from getting infected. Then there's the element of treating those who are already infected when they are eligible to be treated. There's been a push to get the drugs, to get the test kits so that people know their status and then go and get treated, and to train the health workers who are able to actually give the quality treatment. An aspect where I think we have to do even more is in terms of preventing mother-to-child transmission of HIV. We have one of the highest burdens of children that are being born of HIV-infected mothers. Eliminating mother-to-child transmission is a possibility, but we have to do a lot more in that direction because so far we've not been doing very well as a country. And it is related to that more recently we launched the Saving 1 Million Lives initiative, a component of which has to do with preventing mother-to-child transmission.
Take us through recent activities with regards to the fight towards HIV/AIDS in Nigeria.
Well, you know, this is a very large country, so there are activities at different levels. At the national level, at the subnational level, as well as local government. There are non-governmental entities that raise resources and do their own part. From the government's own perspective, I think we're focused on accelerating progress initially in a set of states, the first phase for the scale of PMTCT. And so now, with this new push, particularly with the Saving 1 Million Lives initiative, we're trying to see how we can accelerate progress in preventing mother-to-child transmission, which is just one element of the fight. On the treatment side, as you know, the federal government has been increasing its own allocation for purchase of drugs and complementing what other development partners like the US government's PEPFAR initiative, the Global Fund, in terms of deploying effective treatment to those areas that where people actually are getting treatment for that. Now, the preventive side, there are lots of other non-governmental entities that are doing awareness efforts. Today, the World AIDS Day, for instance, as you know, Friends Africa is organizing a soccer match in Lagos, basically to help push the idea that there's a lot that people can do to prevent. And some of our very well-known players will be there to actually help raise the awareness. And that's just one partner. But there are several other non-governmental entities that are also involved in this effort.
The federal government recently announced plans to introduce HIV/AIDS tax to increase domestic funding. Where are we with regards to this incentive?
The stark reality is that right now we have about 350 to 400,000 Nigerians that are on treatment for HIV. Ideally, all those who are eligible to be treated should be treated because HIV, in fact, can be like a chronic disease, but it's expensive and you need resources to be able to do that. Now, our partners have been supporting, but over time, I don't think we will expect them in the long run to support indefinitely. So if we really want to make progress, there are opportunities that we can actually tap into to raise additional resources to finance health. So the idea that's been mooted on HIV/AIDS, I think is an idea that potentially obviously subject to many further discussions, potentially could make additional resources available to get more people on treatment.